Assalamu alaikum. In this video I discuss shoulder joint. Do you know, acting in conjunction with the pectoral girdle, the shoulder joint allow for a wide range of motion. Let's start discussion. It is a ball and socket type of synovial joint, articular surface head of the humerus and glenoid cavity of scapula and glenoidal labrum. The ligament of the shoulder joint, fibrous ligament attachment, medial attachment, peripheral margin of the glenoidal cavity. The lateral attachment, anatomical neck of the humerus, access to area, upper end of the intertubercular sulcus due to the passage of long head of the biceps brachii, and inferior medial part, capsule extend up to the surgical neck. The transverse humeral ligament is connected to lip of the upper part of the intertubercular sulcus. The movement of the shoulder joint, flexion, pectoralis major and anterior fiber of the deltoid, extension, teres minor and posterior fiber of the deltoid, abduction, middle fiber of the deltoid and supraspinatus, adduction, anterior and posterior fiber of the deltoid, pectoralis major, teres major. Medial rotation, pectoralis major, anterior fiber of the deltoid, lateral rotation, posterior fiber of the deltoid. Shoulder joint is a weak joint due to shallow glenoid cavity. How stability of this joint is maintained? By rotator cuff. It is a muscular tendinous bench which is formed by the four muscles Subscapularis, Supraspinatus, Infraspinatus, Teres Minor. They are attached with the fibrous capsule of the shoulder joint which keep the head of the humerus with the glenoidal cavity. Glenoidal labrum. A fibrocartilage rim increases the concavity of the glenoidal cavity. Coracoacromial arch prevent upward displacement. Rotator cuff. Glenoidal labrum. A fibrocartilage rim which is attached to the peripheral margin of the glenoid cavity help to increase the concavity of the glenoidal cavity. Nerve supply of the shoulder joint, axillary nerve and lateral pectoral nerve. Axillary nerve arises from the posterior cord of the brachial plexus and lateral pectoral nerve arises from the lateral cord of the brachial plexus. Blood supply of the shoulder joint, anterior posterior circumflex humeral artery. Applied anatomy, dislocation is common due to the laxity of the ligament and laxity of the ligament and disproportion articular surfaces. Axillary nerve may be affected. Another important functional anatomy is frozen shoulder tendinitis involving rotator cuff. So this is the brief description of the shoulder joint.